So, thank you for joining again today. And where do you work?
I work for the VA,
Uh-huh.
and I don't work for a facility. I work for the network offices. So the VA is divided into different um, networks across the country with, similarly geographically located um, network. So it's several hospitals underneath a network director, and the network director reports up to the secretary of the VA.
This is the Vision.
Yes.
Okay.
So it's Veterans Integrated Service Network.
Uh-huh. And how long have you been with the VA?
I've been with the VA for almost 11 years. And
Okay.
prior to that, I was with the Department of the Navy for a while.
Oh, wow. Um, so were you in the Navy yourself?
No, I was not.
Okay. So what were you doing at the Navy before?
I worked at the call center, scheduling appointments for mostly for dependents. We had a few active service clinics, but it was mostly like the dependents, the wives, the spouses, the children, the even some of the retirees that
Hmm.
got seen through that hospital that I worked at.
Okay. So then how many years would you say that you've worked in federal service?
I'm almost 15.
15?
Yeah.
Okay. And what do you do now at the Vision?
I work in a branch of human resources. It's not like the normal things that normal people think of human resources. I don't hire people. I don't do like employee relations. I work in an area that we ensure that help ensure that the facilities are following specific staffing policies
Hmm.
and that their organizational structures are in alignment with, the applicable laws that, either Congress has passed or just some of them are just like straight up medical laws. Like you can't have a nurse supervising a doctor. Like you can't do that. That's not a thing you can do. So um, we're there to ensure and consult with the facilities to make sure that they're following all the appropriate rules.
Okay, so do you have a background in policy?
No, it's something that a lot of times when you get hired in the government, you kind of end up getting like mostly on the job training where you get one job leads to another job leads to another job, and you end up getting everything you need to know to do the job. Obviously, like we don't hire people just because, but it's typically like through other positions you learn a lot of
Yeah, totally.
the
That
policies you need to know.
that's what happened to me when I was in my federal position. Did a lot of travel arranging and vouchering and accounting stuff. I don't have an accounting background. I don't have a background in travel arranging or anything either, but you learn that stuff on the job. Um,
Yes.
but which begs the question why even go to school anyways if you just learn how to do everything in your job. But that's a different conversation.
Right.
So, were you in this position the entire 11 years?
No. I've done a bunch of things. I've done um from like I said, like I was a scheduler. I've done more administrative paper pushing kind of jobs. I've done one other job in human resources prior to the position I'm in currently. Um, just kind of worked through and upward and through the system.
So then what difficulties are you experiencing now?
Well, the return to office, and I use the word return loosely because I never had an office in this position, has been rough. I've been in this position. Well, I've been on this team since late 2019. And when
Hmm.
we were hired in and we started this team in 2019, it was you will be fully remote soon. They had to get a lot of things in place. Like we didn't have equipment. They didn't have computers for us. They didn't have a lot of the things we would have needed to be able to go home and be successful. So for a while, it was like they were projecting like June of 2020. Well, March of 2020 changed all that. They sent us all home. Um, I was not didn't have any equipment actually. I was working off of a remote desktop for about 4 months until they were able to even give me a laptop. But it was by design, we were designed to be a remote team. And a lot of the people I work with don't even live within the catchment of our vision. So I daily on calls with people all over the country because that's how we were designed to be remote and designed to be everywhere. And even, so when I'm on with my team or with other members of HR, I am on the phone with people from who knows where. Um, and so now I get to drive at least an hour each direction to sit in an office, um, surrounded by people who do different jobs than I do, and being on the phone with people in other offices that they had to drive an hour to get to. Because a lot of what I do does work with the facilities, but I work with all of the facilities in our business. And so just because I'm sitting at one facility does not mean that's where my work is. My work is all over, that whole area. Plus, my coworkers who I work with a lot are all over the country. So, yeah, literally, I drive an hour to an hour and a half each direction to be on Teams calls all day.
It's crazy. I think that's efficient
Yeah,
or helpful.
no,
Mm.
it's not helpful at all. I can count on one hand the number of conversations I've had with people actually at the facility that have kind of spontaneously come up, um, that we've been able to like back and forth one, in the office, but that would have completely happened over the phone. I've done this exact same thing with people that are not in that building over the phone. You call them up and say, hey, let's chat about something. Let's bounce some things back and forth. It does not help to be in the same office.
Yeah.
Except now, because I don't have an actual office, I'm in the hallway. People walk by and interrupt my phone calls all day, every day.
You're in the hallway?
Yeah. There's like an open space that's like, was designed to be like a reception area, and they put desks in it for us because there's not enough space.
That's crazy. Do you guys have
Yeah.
any privacy curtains or something?
Nope. Nope. Not
Wow.
where I'm at.
Wow.
Like
So
it was designed to be a workspace, but
mm,
like a receptionist work, not me doing what I do.
so then how does that affect, the privacy of your calls?
Um, I whisper a lot,
Uh-huh.
because a lot of times I am on calls that I can't just announce to everybody the things I'm talking about. So I end up like having to like put my microphone real close to my mouth and whispering,
Yeah.
because just because I know something doesn't mean the people all around me need to know it yet.
Yeah.
Um, I I do some work with like when people have a like maybe a settlement agreement that requires updates to systems and stuff. I do some of that. I
Mhm.
don't do tons of it, but it
Mhm.
comes up. It's mostly has to do with maybe a new policy that's coming out. Um, or so like big VA writes a policy, it comes down to us, and then we have to interpret it and decide how we are as a vision are going to interpret and put that into place. So a lot of times I'm on calls where I'm working on that side of things, um, where the people around me don't need to know this yet because maybe it's pre-decisional or it's just something they don't need to know. When we had um, the designated resignation program, we had several of our leaders leave, and I was part of the conversation about who they were going to be putting into these positions that are vacant now, and how we're going to have to restructure our work groups because certain people left, other people are taking those spots, and maybe we had to move some stuff around. So I'm like, the people around me don't need to know all of this because some of the decisions even were changed after like we talked about it. They're like, oh yeah, this is going to happen, and then oh never mind, something else is happening. And so if they hear my conversation, then they think one thing is happening.
Yeah.
Um, and it's rough.
Yeah. The so some leaders have left.
Yeah. We lost two fairly high up on our food chain leaders in human resources.
Mm-hmm.
We also lost a couple like unit supervisors. Um, and then all the fallout with that, like we had to replace those leaders with somebody, and then we had to replace, like chain reaction down the line because we had to have someone. It's called like a detail, so they go in there temporarily. They've been detailed into those positions. Well, that also in a couple of cases required certain sections to be moved around because of some of the rules that we have in place. Like you cannot supervise somebody in your own family. You can't be in the same line. And we have quite a few places where we have, spouses or siblings or parent childs that are all kind of in the same area that we had to move them around because they can't be in the same. You can't have someone in a supervisory position um, in the same line as their family member.
Yeah.
So you have to we had to remove whole groups out from underneath a certain line to keep that from being a conflict of interest.
Yeah. I mean, that's great that one, that there is that rule. That and two, it's great that it's actually enforced. I, as a former federal worker, I'm familiar with this, but I think a lot of people outside of the federal workforce, they just assume that people get jobs in the government because they know somebody, and there's all this sleazy, slimy stuff like that goes on. But no, it's we follow the rule.
Yeah.
So how has the loss of leadership affected your job?
Um, so we're just now in the last 3 weeks seeing those most of those people who have left or have just left in like July. So there hasn't been a ton of fallout on it yet. Um, but it definitely is shifting. Like my supervisor has a different supervisor now. So we have a different line from us to the chief of HR. So there's definitely some shifting of not necessarily expectations, but shifting of like how we communicate um, through up to our chief of human resources, or how um, just those kind of things that come with just your supervisor getting a new supervisor. Some expectations are changing on our ends.
So then my question is, on your team, how many people would you reckon that you've lost in total?
We have didn't actually lose anybody on our direct team.
Mm-hmm.
We lost one person who was indirectly on our team.
Mm-hmm.
And it was actually very sad for me because he was the last person that was initially hired onto the team when at the same time I was when the team was first kind of standing up. So it was kind of like, oh, I'm the last one standing from that original team. But um, nobody from our actual unit left. It was just we had a couple of leaders go. We had, I don't even know, maybe 5 or 6, and then but we lost a bunch of people elsewhere within human resources. So we did take a pretty big hit. Partially, I think, and just as me speculating, there was a lot of uncertainty whether we were going to be able to keep jobs. Um, there's a lot of there's still quite a bit of trepidation, even though they said that they're not going to be doing the reductions in force. Um, we all read policies all day long, and so when they said there's no large scale reductions in force, we all read into that, well, is there still going to be small scale?
Yeah.
Or is there still going to be restructuring where they're going to somehow take our jobs from us? Because this is what we do all day.
Mm-hmm.
But we lost a lot of people in HR. And so where my team wasn't as hit hard because we didn't lose anybody. Our team stayed pretty solid just in general throughout HR, there's a lot of shifting of workloads and changes because a lot of people, got new supervisors, or a lot of people got put into a supervisory role because either their supervisor left or their supervisor was now detailed to a different position to cover down for that person. Um, you lose 4 or 5 leaders in a work unit, and then that's going to shift at least 10 people around. 5 people to cover behind them, and then 5 people to cover behind those 5. And we're not terribly deep in structure, so but if you think about some of our facilities, that maybe if they lost 5 people, if they're 4 or 5 supervisors deep, so 5 people leave, you got to move 5 people into those spots, and you got to move 5 people into those spots, and you got to move 5 people into those spots. And it may get a few less with each layer, but every time you have to go into a new layer of structure, you have to put a different person into that role. Or even if you're not putting them into the role, you're having to then, parse out their work.
Yeah. So isn't there a hiring freeze still until October?
So yes, but about 90% of our positions in our business are exempt from the hiring freeze. So they talk about there being a hiring freeze and them not hiring anybody on, but when you do the math, it's about 90% can still be hired.
So why are you guys exempt?
They exempted a lot of VA because it's a public service, public healthcare agency.
Mm-hmm.
So pretty much the only positions that they exempted were some of the purely administrative,
Mm-hmm.
but not all. So HR is one is we're on the hiring freeze. They can't hire anybody behind us.
Mm-hmm.
But even most of the pseudo administrative positions got put on an exemption because you cannot run a hospital without housekeepers.
Yeah.
You cannot run a hospital without electricians.
Mm-hmm.
You cannot run a hospital without, motor vehicle operators to drive shuttle patients between facilities, or to take supplies from the main facility to maybe an outpatient clinic. So when it came down to it, about 90% of our positions can still be hired.
Mm-hmm. Okay. So what are some major changes that you've seen between the first Trump administration and the second, since you were there during the first Trump admin?
It's so I was in a different role until the very end of the first Trump administration. So I was in a more clinical at the facility working with I was still administrative since an administrative person, but I was working an administrative person in a clinical setting.
Mm-hmm.
Um, it's just I didn't notice a giant difference between Obama to Trump to Biden.
Okay.
Um, Other than the things going on politically in the world, I didn't notice it a lot at work. It
Mm-hmm.
wasn't a huge at work thing. However, this administration, like as soon as he took the oath, everything got crazy and scary. We didn't know if we were going to have jobs for months and months and months. We didn't know if like I said, we have a bunch of people that don't live in our catchment area. And so
Mm-hmm.
they actually, none of them end up having to go back to an office because there's no space. And even
Mm-hmm.
if there is space, like facilities are, the facilities are reluctant to give our human resources, people who live in the area space. They're really, really reluctant to give that space to somebody who doesn't have anything to do with our visit.
Mm-hmm.
So a lot of them, as far as I'm aware, all the ones I'm aware of never had to go back. But then there was the question of, is lack of space going to make them say, we don't need you because we don't have space for you?
Yeah.
There was also a lot of worry that they were just gonna, and they talked about just outsourcing HR somehow. Which, as you probably know, anytime you outsource something, you do a contract to something that actually costs the government way more money.
Yeah.
But it sounds nice. Um, they talked about having to get back down to 2019 numbers, but I know of at one hospital, one of the hospitals, they have not opened, they've absorbed from a contract 3 large outpatient clinics where 5 years ago that place was open. They were seeing those patients in that area, but everybody was a contractor. And since then, they absorbed that entire location into federal workers. So just immediately, without adding any service, we added hundreds and hundreds and hundreds of employees because weren't counted 5 years ago. No one, they didn't care. They didn't not count those people at all 5 years ago, but now they're counting them. So, okay, so we're going to go back to 2019 numbers and we automatically are in the hole just by those locations being open. And that's one facility. And I know all of our facilities have added. We've added separate outpatient locations. We've added like the whole women's health initiative has stood up since then. So there's a whole women's clinic push where there's physical locations that are essentially for women, veterans, that have just been added since then. And you're going to say we have to go back to numbers, and we've added all these good programs. We've added to the caregiver support program immensely in the last 5 years. We've added to substance abuse programs in the last 5 years. And so where are they going to get, if they're not going to let any clinical people go, where are those 15% reductions going to come from? And it's going to come from the 10% that are exempted from hiring freezes.
Yeah. So do you know why they chose 2019 as the year?
I can speculate.
Uh-huh.
Who was in charge 5 years ago? But I don't know if that's why. That's just the number that they keep saying. Like, that's the year they keep saying. But from what I understand is the VA has dropped a lot of that. But for 6 months, everybody was like, am I going to have a job or am I going to be riffed? Like, we held seminars for people. This is how you find out how much your payments would be if you're rich. This is how you find, they held a whole seminar on applying for jobs in the civilian sector because we had no idea what was going to happen. And so it's just a lot of angst, a lot of uncertainty. A lot of people being really, really mad about going back to the office because we were all hired. So I was in one role in 2019, 2020, and then the end of 20, like this time in 2020, I got put into a different role, and that role was always remote. It was hired. My job offer said this is a remote position, but yet they're going to make me drive to a facility. And for a really long time, they couldn't even tell us what facility we were going to go to. So the way that it was worded is if you were within 40 miles of a VA facility, you have to go in, but they weren't saying they were going to put you at a facility within 40 miles. So our network offices are about, as the crow flies, I live about 60 miles away from that. But as you drive it, it's like a 3-hour drive without traffic. And they were like, you could have to come back to this network office and spend 6 hours of your life driving.
Yeah. No.
And they couldn't tell anybody anything.
Yeah. That's crazy.
Yeah. And that was like the biggest, like just the uncertainty of they're holding something over our heads and they aren't even going to tell us. We have no idea what was going to happen on a daily basis.
Yeah. So how are you feeling now? Do you feel like you might be riffed or do you feel stable?
I feel fairly stable. I feel like we'll probably be okay. In general, I still have a slight because when they they give that preference to veterans to stay, which 100% they 100% should do that. But I'm not a veteran.
Let me pause for a second because you cut out for maybe about 10 seconds. Can you start again?
Yeah. Sorry. So feel like we'll probably be okay, but I still have a little bit of a worry in my mind because when they do reductions in force, if they do it properly, veterans have preference to stay. So if they
Hmm.
say we're going to have to cut 10% of the workforce, as long as that 90% is veterans, they don't get touched. But I'm not a veteran. So
Hmm.
I don't, there's 100% veterans should have preference. They should be able, veterans should always have a job within the federal government, in my opinion.
Hmm.
That should be all thing that they have.
Hmm. So you feel fairly stable, but since you're not a vet, there's a chance that you might get cut.
Yeah, if they were to do cuts.
Yeah. Okay. So has the DEI affected your job?
Um, Not tons because I don't deal with that side of the policy much. I've seen things and I've heard anecdotally from people I know um, about veteran care being like suffering essentially, specifically with like transgender and women. Um, because, like I said, we have whole women's clinics that have stood up and they
Mhm.
haven't said whether we get to keep the women's clinic or not. It's a clinic specifically only women veteran go to that location. No men
Mhm.
go there. There may be a few male employees, I'm not sure, but it's only to care for women.
Mhm.
I've heard anecdotally that there was a veteran that is transgender and is now no longer able to receive their hormone treatments. They're post-op, but they cannot get their hormone treatments
Mhm.
anymore. They have to go completely out of the VA system in order to get their basic care.
Yeah. Wow.
But yet a someone who was born a woman sure can get estrogen replacement. Like men can sure get Viagra still.
Yeah. Wow. And
So yeah,
that person outside of the VA, I'm sure.
yeah, yeah. So that person essentially got pushed out of the VA because they can't get their medication anymore.
Yeah, they can't get the care that they need. Wow, that's terrible.
Yeah. So it has not affected me personally, but I know a lot of people in a lot of different areas. Um, and I've heard things like that. Um,
So since you work in policy, I'm curious, have you seen any policy changes during your time since Trump 2.0 came in?
so the biggest policy thing that we're dealing with is um, there's a freeze on restructuring.
Hmm.
And that is a huge, huge part of my job is working with the facilities when they need to restructure something or they want to think about restructuring something. We consult with them and we say, hey, yeah, that's great, but all of these rules, you have to follow these rules, or yeah, you're following the rules perfectly, or um, we are able to give them advice and stuff like that. But since we haven't been able to do anything with restructuring, we have an issue where like, hey, we were mid restructuring when this kicked off. What do we do now?
Hmm.
Or they just need to do something. They lost a whole bunch of people, either through designated retirement program, the or they just retired. Like we have people are normal have left under normal circumstances also. And
Hmm.
a lot of times like, oh well, as soon as this person retires, we need to change something. Or we're gonna change something. Well, now we can't do that. So we end up spending a lot of time just telling people, sorry, we can't help you because of the hiring freeze. That's not the hiring freeze, sorry, the restructuring freeze. Um, and that's huge because that is it literally is something that happens every single day. And people who aren't in the system don't understand that every single day people are being moved around. Also, just yesterday, we received notices about unions being dissolved. And unions are a huge part of what we do and how we do it, because we have to be very familiar with the collective bargaining unit contracts because it's the collective bargaining unit says you need to give an employee a 30-day notice if you're going to change their supervisor. It's something we know we have to look for. Did you do that part? I don't know what the fallout of that's going to be because, like I said, it literally came out yesterday. um, but the unions are going to be a huge, huge deal, and we've been kind of having those conversations for a while now because I think it was what April, May that he said he was going to disband the unions, but nothing really happened for a while. So it's now happened. Um, and most of our employees are now no longer covered under the union, which is terrible. Unions are good.
Yeah. So, yeah, you have no rights as a worker under the VA.
Under the bargaining,
Yeah.
collective bargaining units.
Yeah. Yeah. That's terrible. So do you deal with health policy at all?
Not really, no.
Okay.
Mine, I'm all like staffing and hiring and employee relations kind of stuff.
Yeah. And these policies have affected your work. And the restructuring of people has been a difficult point for you, and the hiring freeze has been difficult. So are there any positives that you can see from the Trump administration coming in?
No, honestly. I haven't seen a single thing that has come up that's benefited um, anybody but the administration, essentially.
Yeah. Okay.
I mean,
So,
even to like, sorry, one other thing, like they had to rewrite the contract of the building I'm in. So I'm in an outside building. It's a contracted building because
mhm,
we were using too much electricity and water
really?
for the contracts. Like they had to rewrite it because the electricity to run the air conditioner specifically was the air conditioner's pulling too much because they've shoved 3 to 4 people per office that are only supposed to have one person in them. So we have to crank the AC up in order to stand it.
Yeah.
And how many people are flushing the toilets? Way more. Like flushing
Yeah.
toilets, washing your hands. The water bill went up, so they had to rewrite the contract of the building.
Yeah. And this is because of the return to office.
100%.
Yeah. So then the bills for the government are going to be increased.
Yeah, I did the math just on the equipment that they gave me to come back to the office that they had to provide for me was almost $2,000 just in equipment, and
Yeah.
that's one person.
Yeah.
So that's monitors, keyboard, mouse, because all that stuff I was using was my personal own stuff at home.
Mhm.
Um, a phone, a new phone. They had to give me a new phone. They had to a new chair. So there was no chairs. That my desk was there, so I didn't count my desk. But a lot of people had to get new desks because they didn't have. They had one desk in an office, and now they put 4 people in it. So they've had to completely put new furniture in there, and so they had to buy 4 new desks for all those people.
Yeah. I I don't know what the point was of the return to office, but I mean they clearly did not think this through at all. Like it costs more for the government to bring people back in. It's less efficient. You have difficulty doing your job because you have to
Mm-hmm.
stay quiet due to, the level of secrecy for your job. And who wants to work in an open area where people are
Yeah.
time?
And I happen to have one person who I work very closely with that sits near me.
Mm-hmm.
But it's worse because if we have to talk to somebody that's not the two of us, we can hear, like I hear her talk and then I hear it in my headset. And then
Yeah.
she hears me talk and so it's we actually distract each other
Yeah.
because we're sitting near each other.
Yeah.
And we're the only people in our whole team that sit next to somebody that happen to sit next to somebody
Yeah. Yeah.
on
No,
our team.
no, it's, yeah, that's
Yeah.
frustrating. Is there a main message that you would like to get across to the public?
Um, I think the biggest thing is that everybody, I mean, the biggest thing is they keep talking about fraud, waste, and abuse, but there's literally none of that.
Mm-hmm.
We train for fraud, waste, and abuse yearly. We know how to report it. The biggest fraud, waste, and abuse was going back to the office. Like that is so wasteful. And so many people that were initially brought back to the office have been able to get an accommodation to go home. So they bought all of that stuff. They bought that $2,000 worth of equipment, and then the person within a couple months was able to go back and work from home. And it's not equitable as far as who got to go back home. Like there are certain reasons why people can, but it's not like I have 9 coworkers at home and I have 9 coworkers that are in the office. And yeah, there's reasons why those 9 people, I don't know, I'm just making numbers up. Those
Mm,
9 or 10 people that are at home, but I have to drive an hour into work. Where
mhm,
somebody who lives maybe, within a few miles of the facility had a medical condition or had some reason why they were allowed to go home. So it
mhm.
wasn't even like, oh, we're going to put people that are close. No, 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 no. I drive an hour and a half every day to sit at my desk, um, doing the exact same job I've been doing for 5 years at home.
Yeah.
And it's just remote work is way more efficient. And if anyone doesn't believe that, then they're listening to the wrong people because people who remote work, we a lot of times don't even get up to go to the bathroom. Or if we do, our bathroom's 10 feet from our desk because we're in a bedroom that has a bathroom and we're gone for 2 minutes versus having to go and wait for a bathroom stall or, walk to the other side of the building. Like it just is, we federal workers work hard and remote federal workers, I'm going to say work harder than people in an office because there's nobody just to gossip with. There's no potlucks to go have, spend time on. There's no water cooler talk because we're just at home and we're doing our job.
Mm,
And all the policies that have been put into place have exponentially slowed everything down.
mhm.
I have not seen a single one that helps us in any way.
Yeah. There's so much that I would love to say and I would love to talk to you about, but this is your interview. So have have we missed anything? Is there anything else that you would like to say?
um,
Here we go.
no, I think that's kind of pretty much covers it.
Okay. Yeah. I'm sorry that you're in this situation and I really hope that you're able to keep your job. I hope they figure out some kind of distractions. Oh, I did want to ask you, since you said that you're 60 miles outside of your duty station, right?
Mm-hmm.
So I know that there's a rule that if you're 50 miles, more than 50 miles outside of your duty station, then you can receive per diem. So since you're 60 miles, did you ever receive per diem or any like a
No, because they went with the closest main facility
uh-huh,
for everybody. So that one's it's a 37-mile drive. So
uh-huh.
that's where I go every day is to the closest main facility. There's 3 smaller outpatient clinic facilities that are closer to me, but I have to drive to the main facility. But I don't have to drive all the way that 60 miles to the network office. And
Okay.
they pretty much said no, they weren't going to give you anybody per diem or mileage. Like this is what it is.
Yeah.
Um, yeah,
So that's at your own expense and they don't have any like transportation benefits or anything.
they do. But the
Okay.
problem with transportation benefits, they're great if you live in an area that it works. So there's a couple
Yeah.
ways you can do it. You can get there's a transit so in a city that well because they can go get on a train, they can get on a city trolley bus or whatever, and they'll take them everywhere. But like if you're in a more rural area, there is
Yeah.
no public transportation that'll get me from my house or near my house to walking distance from the facility. One, and but it would like I figured it probably take me several hours to get there because I'd have to change buses and stuff. Like it's not a convenient thing. I did
Yeah.
use that for a long time when I worked at when I was working for the Department of the Navy because it
Mhm.
happened to work out well for me.
Mhm.
Um, but it doesn't work. in this situation. The other way to do it is to get into a van pool. But the problem with the van pools is you have to be, near people that work your same shift at your same location. And that hasn't worked out for very many people that I'm aware of because we all work slightly different shifts. And again, you have to live near them for it to work. And if you don't live near them, I live in kind of an odd area. Yeah, it just doesn't quite work for me. Some people were able to do that, and that was actually my plan, was to get into one of those. But the other problem with that is it strands you. And so like I have kids, and so if you're at work and one of your kids calls and needs to get picked up early from school, if you're sick, you're stuck. And yeah.
So you have to go into the office 5 days a week.
Mm-hmm.
And travel very far. And some people would say, well, that's work life. Okay, well, some benefits of having a good job is having transportation benefits, or some way to cut the cost of getting you to work. Some incentive to keep you around. Do you feel like you'd want to leave your job at all because of the pressure that you're experiencing?
No, I like my job. I love working for the veterans. And even though every single person who works for the VA, even if you don't see or talk to a veteran in a veteran role ever, we're still supporting veterans because we're still working on doing what is needed to hire people to work and help the veterans. So it's still everybody who works for the VA in any capacity is supporting veterans. And a huge number of our employees are veterans. Mm-hmm. So even if we're not serving them in a veteran capacity, we're still serving them in a, humanitarian capacity. We're still working with the veterans every single day. Mm-hmm. A little selfishly, I have enough time put in at the right age that if I leave federal service for any length of time, that will seriously compromise my retirement. Mm-hmm. Because of the number of years I have in, how old I am, and how old you can be to retire, and what benefits you get at certain years of services. Mm-hmm. So no, I don't want to leave the VA. I love my job. I love what I'm doing. I signed up for the long haul, went to work for the government, and I don't want to go anywhere. I can't, what I do doesn't exist anywhere else, and that might be part of it too. Like nurses, doctors, those jobs exist elsewhere. My job is very specific to government workers and government laws, and other people don't have to follow they have to follow rules. It's not like they can do whatever at private hospitals, but there's so many government rules that like you don't need my job in other places because there's less rules to follow. And I did kind of look at and there's just not, for what I do, it's not something that is out there in the public sector. Mm-hmm. But either way, I like being a federal employee. I do this for a reason. I got into working as a federal employee to do this job, or to do the work I do, whether it was this job or whatever other job I've also had. I've had opportunities to leave the federal government, and I don't want to.
Yeah, 100%. I wish I still had my job, obviously. Yeah, I really appreciate your time. Yeah, thank you very much for your time. If you have any questions or comments or anything, feel free to message me or email.